Well, back with Dr. Patel. Hi.
Hi, Helmut. How are you?
Good. Well, Dr. Patel, we talked a lot about all kinds of stuff. Now, tell me, implants and dentures. I mean, with no doubt, dentures are a lot cheaper, and finances do play a role with lots of people, especially in an economy like today. But can you point out, all the advantages and the disadvantages and the need for one or the other, or the functionality for one or the other? Can you really explain that and point out all the things which could or could not happen with one or the other?
All right. Well, that's a long question, Helmut, but I will try and justify the answer to this. Number one, implant is fixed. The dentures are not fixed. The bridge is fixed. The dentures are not fixed. So between the fixed and removable, which are the dentures, there is all the disadvantages of a patient's normal social life. So when a patient goes to a restaurant, his most worry is that what will happen to the denture? Will it come off? Will the food get underneath the denture? Do I have to run to the restroom and clean it? So that is one worry. Socially also, he has to worry. Most of the patients, they do remove the dentures at night and put it in a glass. At times, the patient comes in, oh, my dog ate the denture, and all those simple things. Or by mistake, I threw it in the trash. It was wrapped up in a napkin, and I threw it in the trash. Those are the social disadvantages of dentures to implants and bridge. Also, in the dentures itself, it covers more area of the gum tissue. So the day-to-day eating habit is affected because the patient is not able to taste the food as good as when it is in a bridge or an implant. Now, between the implant and the bridge itself, as we have already discussed it in our previous videos, the most common disadvantages is, of course, the aesthetic part. The implant is much more aesthetic. It looks like a natural tooth coming out of its own socket. That's one. The bridge may not look like a natural tooth because the adjacent teeth are cut and it looks like something has been pasted on top of it. So aesthetically, patients are affected. Number two, with the implant itself, there is no adjacent tooth cut, and with the bridge, we have to trim the adjacent tooth to fit in a 3-unit bridge for one tooth replacement. So these two are the major things. And number three, the cleaning habit itself. If the patient already had to begin with had a bad cleaning habit, or if the patient is all the time in a socially very busy and business-wise is very busy and moving in and out of the house early in the morning very quickly, just can catch the train or go and beat the traffic on a major highway, they are not able to clean very well. And in that sense, the plaque around the implant and the bridge will be affected. The plaque around the implant can be very easily cleaned, but the plaque around the bridge may not be very easy. Number three, if the bridge is slightly open or if it is not very tightly fitted, which 90% of the failure happens because of the bridge not well fitted by the dentist. So these are the last disadvantages of a bridge to an implant.
Let me ask you something. I've heard, and I'm not so sure, I've heard that when you have your normal teeth in it, the root of the tooth prevents the bones from shrinking. The whole arch, as we have like two arches, two kind of like horseshoes in our mouth, and it prevents it from shrinking, literally caving in. And I have heard that so when you put a denture in, the root doesn't get replaced, where yet with an implant, the metal stick, the metal rod replaces it and it cannot shrink. Meaning, if you have a denture, your arch starts shrinking and eventually you start kind of caving in and start looking like a dried out tomato and basically look ugly. Is that really true or not?
Yeah, it is very much true. If it is a full mouth denture, we recommend that the denture should be relined every 3 years. Why it should be realigned? Because there is a shrinkage. There is a shrinkage of the bone. Immediately after extraction of a tooth, the bone itself shrinks about 30%. And then within the 9 months, it again shrinks about 28 to 30%. In overall, there is about 50 to 60% bone in the shrinkage itself. The bone itself shrinks. Not properly, also applied to the bone itself. Shrinkage is once it around the implant shrinks only if it is not kept clean. If it is kept clean, and if the implant had been placed nicely by the dentist in the first place, it won't
Okay. Well, thanks for telling us about that. That's, not looking pretty, that sounds like a pretty bad thing, and it looks like a dentist can actually be a great cosmetic surgeon by just replacing the teeth correctly. Thanks a lot, Dr. Patel.